Hello, my name is Becca. I am a dietetic intern from Illinois State University. And today the in-service topic I'll be discussing is the International Dysphagia Diet Standardization Initiative, short for IDDSI, and that is the name you'll be hearing me call it the rest of the time, IDDSI. For the IDDSI in-service objectives, the first objective is for attendees to be able to identify foods that are safe for patients following various levels of the IDDSI framework, and being able to look at IDDSI testing method results to help identify if the levels are appropriate. And also, attendees will be able to state the purpose and benefits of IDDSI in improving patient care. The in-service agenda is discussing introduction to IDDSI, the levels of IDDSI, and how the IDDSI testing methods relate to the levels of IDDSI. And then at the end, we'll follow up with interactive IDDSI scenarios that is just 5 questions. First, to understand the importance of IDDSI, I will give some more information about dysphagia. Dysphagia impairs the ability to obtain, prepare, and present food to the mouth. And that could even be from the ability for individuals to bring food to their mouth, all the way through the process of them swallowing and having it go down the esophagus instead of aspiration, where food or liquid or other materials would go down the trachea and could end up in the lungs, which could lead to pneumonia or other conditions. And dysphagia is something that is important to prevent, to further prevent weight loss, anorexia, and dehydration, but most importantly, preventing malnutrition. Because inadequate dietary intake because of dysphagia can discourage patients from eating and getting those nutrients that we need from food, especially when the patient is trying to heal or recover. The purpose of IDDSI is to create a system for naming, describing, and testing various texture modifications for liquids and solids to make sure they are appropriate for patients to receive nourishment. IDDSI depends on the collaboration between SLPs, which are the speech language pathologists, registered dietitians, registered nurses, food service managers, and even really the collaboration of all food service staffs that are working to prepare meals for patients. And overall, IDDSI prioritizes the patient's safety. By having that standardized terminology, this allows for all of those team members to be on the same page and providing food for them that is served to the specific level that the patient needs to be able to consume that food or beverage. And in comparison to the widely accepted NDD that was used before IDDSI was created, that IDDSI provides a more expanded terminology of the liquid consistency, as you can see on this drinks pyramid on the picture to the right. IDDSI also provides appropriate food textures for patients and has proven to reduce rate of malnutrition, leading to less frequent hospital visits and also shorter length of stay. The first level of the IDDSI framework is the thin liquid level 0, and this level flows like water, and some examples are water, milk, juice, coffee, and tea. And to test levels 0 through 3, we use a gravity flow test using a 10 milliliter syringe that I'll be talking about more in detail next. So for the IDDSI funnel flow rate of liquid, first step is to make sure the funnel is clean. So even if it was already clean, you're going to wash the funnel again and use it to test the flow of water first before you put any of the other liquids that the patient would be served in there. And you want, since water is a thin liquid, you want it all 10 milliliters of it to be flown through within 10 seconds. And then once it does that within 10 seconds, you can use the liquid that you planned on testing. And it's important to note that the liquid that you're testing that goes through that syringe, even if it passes the syringe test, it should not be used to serve to the patient. So you'll discard that liquid that was in there. And this little diagram helps over to the right. So as I mentioned, the thin liquids, there should be nothing left in it. But for an example with the level 3, we want there to be no less than 8 milliliters still in there. So to follow the flow rate of liquid, the first step is to clean it and then run it through water. And then when we're finally ready to pour the liquid we're testing in, it'll be up to the 10 milliliters. And then at the same time you release your pinky finger, you'll also start the 10-second timer. And then you will score if the liquid in there meets a certain level based on how much is left in the syringe. And then after you're finished with the test and determining the IDDSI level, it's also important to know when to discard a syringe. So the syringes can be washed about 30 times in a commercial dishwasher, but it is important to know when to throw them away if they have become morphed or broken, cracked, anything like that. Or even if these like hash marks for the milliliters are starting to come off, that would be an appropriate time to also discard the syringe. Slightly thick liquids, level 1, are thicker than water, but has the ability to flow through a straw. And these can be things like nutritional shakes, infant formula, some fruit nectars. And to test this, we are using that gravity flow test. Mildly thick level 2 is pretty similar to slightly thick, but different in it. The fact that it requires more effort to drink through a standard straw, and it has the same examples, same testing method. So that's where it comes into play that it's really important to know the hash marks that determine what levels the IDDSI liquid tested at after those 10 seconds. Next, we move into moderately thick level 3 drinks and liquidized level 3 foods. And this level allows patients with less tongue control to hold and move drinks longer in their mouth since it is an appropriate thickness. And it is best taken from a cup or spoon. Some examples of this are supplements, thickened liquids, fruit nectars as well. And also the gravity flow test can be used for this level 3. And then the fork drip test can be used as well, and I'll explain that shortly. Level 4, we have extremely thick liquids and pureed foods. These liquids and foods have the same properties when swallowing, and they also have the same descriptions and testing methods. And examples of this are soups, cream of wheat, thickened liquids, and the testing methods are the fork drip test and the spoon tilt test, which I'll discuss next. I like this visual of the fork drip test because when I was talking about the levels, specifically 2 and 3, I believe like the slightly thick levels 1 and extremely thick level 4 are pretty easy to identify because the slightly thick will drip right through, and then the extremely thick sits on top of the fork. But the difference between the mildly thick, for this one, we're looking for it to still drip through pretty easily, and then the moderately thick will leave strands through the fork tines. Next, we have a visual of the spoon tilt test. So on the far left picture, you can see we have peanut butter that is going through the spoon tilt test, and this would not pass for the pureed food because it is sticking to that spoon. We want there to be either a slight film left behind or completely clean spoon, like we see in these pictures on the right. Top picture, we have a clean spoon, and then the bottom picture, we have that film on the spoon, and those are both acceptable for level 4 purees. Next, we have minced and moist as level 5. And these are pieces of food that are small enough to prevent patient from having to take a bite, but the food can be easily mashed with a fork. And then we have particle size restrictions. I like to think of this as the particle size, like when you're mincing garlic or a different vegetable, it's really small, as you can see in those pictures. And then we're doing the fork pressure test to see if it passes level 5. The fork pressure test is used for transitional foods 5 through 7 that we'll be talking about. So that's the minced and moist, 6 easy to chew, or 6, sorry, soft and bite-sized, 7 easy to chew. And to pass, the sample has been squashed and disintegrated and no longer looks like its original state when the fork is lifted. So you see that in the picture over there. And the thumbnail blanches white is an important detail because that is the same pressure that an individual's tongue uses when trying to chew and digest food before it's swallowed. And then for people that don't necessarily use forks and might eat their foods with chopsticks or their fingers, we want those chopsticks still to be able to break the food with minimal pressure. And if it's a finger food, you should be able to rub it in between your thumb and index finger, and the food should not return to its initial shape. Next, we have level 6, soft and bite-sized. I have an easier time remembering this level when I think about the foods that children that can now eat are able to eat. So these are pieces of food that are mashed and broken down with the pressure of a fork, because these individuals that are on a soft and bite-sized diet aren't necessarily able to bite yet, but they can still mash food in their mouth if they're in small bite-sized pieces. And then for particle size restrictions for adults, we have no larger than the width of all 3 or 4 fork tines and less than 8 millimeters for children. And this is used to test with the fork pressure test. Our last level we'll be discussing is easy to chew, level 7, and this includes normal everyday foods that have soft and tender texture. I like to think of this as something like salmon, because if a salmon is cooked properly, it'll be nice and flaky, and you barely should even need a fork to flake the pieces apart. There are no particle size restrictions for easy to chew level 7, but it's also important to note that this IDDSI level is not recommended for people with high risk of choking, and still people should be in the room when a person following the easy to chew diet is eating, because we still want to prevent risk of choking or aspiration. And for this, we use the fork food separation test. For transitional foods at 5 through 7, it is categories of food that change texture when moisture or temperature change is applied. So this is mocking the environment in the mouth when you're eating food. So food is altered by saliva and the warmer temperature. And with these levels, biting is not required. Minimal chewing is necessary. And then the testing methods, the fork pressure test that we talked about, and the fork food separation test. Back to that example with the salmon, it's just that when you're eating it with a fork, it should be able to easily flake apart with very minimal pressure. I wanted to include a slide with a comprehensive list of the different levels of the IDDSI framework and how they're matched up to each testing method, and to go over a little bit more about the spoon tilt test in a practical example. So both of these pictures are pumpkin puree. You can obviously see that they're different textures. So for that level 4 pureed spoon tilt test, this picture on the left would definitely be more appropriate because it's sitting on top of that spoon and not falling off. And it's like a heaping spoon too, so that helps you tell. But there's also that film behind it, like that you can tell the spoon doesn't even need to be tilted. If it's leaving that film after that level has been already like eaten, then it's going to leave that same film on the spoon most likely. And remember, the film and no film, like a clean spoon, both pass the puree test. On the other hand, we have this picture of the pumpkin puree on the right, even in this picture, the spoon isn't tilted properly, first of all, but you can still see that those little like strands of food are left on the spoon. So this would not pass a level 4 pureed test. Now we're moving on to the questions. I'll read the question and then give a few seconds for you to mentally note the answers that you think. How many levels of IDDSI are there? If you chose answer B with 8 levels, you are correct. Remember, with that pyramid picture, we have thin starting off at level 0, and then it goes all the way up to level 7 of the easy to chew foods. What tool is used for that gravity drip test? C, syringe is correct, because you want it to be filled up to that 10 milliliter mark on the syringe. A little bit longer one here. After utilizing the IDDSI fork pressure test method, how would you know that a food passes the test and can be served to a patient as a transitional food? So remember, those transitional foods are the levels 5 through 7. So the minced and moist, soft and bite-sized, and then easy to chew. For these levels, that fork pressure test would be appropriate to use. And to pass that transitional food mark, you want the sample of food to C have been squashed and disintegrated and no longer looks like its original state when the fork is lifted. Even if we're using the chopstick method, you want the chopsticks to be able to break a transitional food. And even with the finger test, you want the shape to be able to change with applied pressure of the fingers. Next question. If a patient is following a level 4 pureed diet, which of the following foods would be allowed? The correct answer is D, applesauce. Sherbet appears to be like it would fit the pureed mark, but it misses it because if it's left at room temperature, the sherbet turns into a thin liquid, which is not appropriate for a level 4 pureed diet. And then the grapes have a skin that pose a choking hazard, and the same with pineapple. The fibers of the pineapple also a choking hazard. So the best answer here would be D, applesauce. Next question, which of the following is not a confirmed beneficial outcome of IDDSI? The correct answer here is D, leads to less work for a patient care team. All answers A through C have already been results from studying the effectiveness of the IDDSI levels in patients with following dysphagia diets. So in comparison to the NDD, the IDDSI framework does involve the interprofessional team, which could lead to more work for the patient care team. But I think it would be important for long-term studies to actually test the time that facilities using NDD still versus IDDSI take, because we do know that IDDSI reduces the rate of malnutrition, leads to less frequent hospital visits and shorter length of stay. So it would be interesting to see if the interprofessional team does actually reduce the time. But right now, it has not been proven yet. In conclusion, IDDSI provides standardized terminology and allows for uniformity across the healthcare facilities in what those places are serving for the different food levels to accommodate for a dysphagia diet. And IDDSI provides appropriate food textures for patients and allows for nourishment, meeting them where they're at along their journey dealing with symptoms of dysphagia. And it's important to remember that all members of the interprofessional team must collaborate for a successful patient experience where they have been served foods that are appropriate to them based on the levels of the IDDSI framework. If you have any questions after watching this in-service, please feel free to email me at rebel3@ilstu.edu. Here are my references. Thanks for joining today.